about to go in for my bone marrow test or biopsy, whatever it's called. A little nervous. Hopefully it doesn't hurt, but they told me they would put me under, so we're gonna hope and pray I don't feel anything, because I've heard it's pretty intense. So we'll see. Gonna get through it and see how it goes.
Conquer the day.
Yep, conquer the day. Thank you, Mom.
You're welcome.
So we'll see how it goes. So that's crazy. Probably gonna feel that.
What are they going to do today?
They're gonna drill into my bone over here and
I probably won't be able to today.
put what is it called? Lidocaine? And I think I'm gonna feel it, and I'm very, 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 very nervous.
You got this. So you survived the bone marrow biopsy. Was it as painful as you thought it would be?
Well, it was different. It was very intense. But I'm here. I survived it. Got through it, and
You have strong bones.
yeah, they said I have very strong bones, and they asked if I work out a lot because apparently I have muscles. So that's exciting. We'll see. Yeah, I just moved in it.
Yeah. Be careful.
Yeah, I gotta sit. But
Okay.
I have video of what they took out of me, so I can show that as well. But it's pretty amazing what they can do.
She's conquering the day.
Yeah, conquered that day.
This one is a chunkier bone, right here.
Okay.
And then this is from the inside of your bone. This is the marrow, and those are the spicules that we'll look at under the microscope to see what's going on with your cells.
Wow, that is crazy.
And then these will be sent to a pathologist, and they'll do whatever pathologists do with all this
Okay. Just got back from my bone marrow biopsy, so I wanted to kind of go into that. I know there's a lot of opinion and I guess fear around bone marrow biopsies for cancer diagnosis. So I just wanted to touch on my experience. So I'll just get into it. So today I went in, had a lot of anxiety, as you could understand. Once again, my blood pressure has been up. That's just a whole nother video. But, a lot of anxiety with these appointments because you just kind of think about it and stress about it. And that's one thing, though, I didn't do for this bone marrow is I wanted to look up, on YouTube or Google bone marrow biopsies, but just to spare myself, any more mental anguish, I did not do that this time, which I'm very glad I didn't. But if you are watching this because you or a loved one are going to be going under something like that, I'm making this, for anyone to maybe ease their mind or just give you kind of a real point of view. And of course, this is my experience only. It could most likely differ depending on the person, but this is my experience. So I'll get into that right now. So I got in this morning, like I said, pretty nervous. The nurses were fantastic, really nice, really great. They got me in, and I expressed to them how scared I was. So at first they kind of went into what they would be doing and asked me if I had any questions. And I said, well, I'm very nervous. Is there anything you can give me? Because when I had called on the phone initially, the woman on the phone who described the procedure said that I would be sedated and most likely, kind of like not necessarily put under, but I wouldn't really know what was going on, or I would be very heavily sedated and I wouldn't be feeling anything. And when I got in there, it was more to my surprise that they would be putting a numbing type of medicine on the injection site. But as far as giving me any kind of like sedative or, you know, anything to calm my anxiety, that was something that I had to ask for. And I was very strong in asking for it. I was very afraid, and I wasn't afraid to express that. And so that's one piece of advice I would say to anyone that would be undergoing this that is a little afraid. Don't be afraid to express your fears about, you know, this procedure or any kind of anxiety that you have. Anything that they can do to minimize that, they should be able to help you. Granted, that, you know, as long as it is safe for you to take, you know, don't be afraid to ask for that, because that can really, really help. So I asked for, you know, they gave me, I don't remember the name of it, but they gave me some medicine for that. But I will say that it really didn't do much. I definitely felt I was very alert, and I knew what was going on the entire time. You know, it might have calmed me down just a little bit, but not much. So I was kind of disappointed in that, to be honest. So once they did that, they had me roll on my back or on my stomach, and the doctor started to basically feel around on my lower back and start kind of massaging in on my lower bones on my back. And so these bone marrow biopsies are usually done on your lower bone, you know, your hip on your lower back. So she's kind of kneading in on both sides to kind of feel, I guess there's certain spots that are better. And that was a little uncomfortable, but you know, she was kneading away. They definitely asked me, are you doing okay? Do you need anything? So that was good. And then we determined that she would be doing the injection on my right side, my lower right back. And just because that was very helpful, because my tumor gives me a lot more problems on my left side. And so I like to sleep on my left side so that I'm not sleeping on my right side and causing more pain or the weight of the tumor going on that side, if that makes sense. So anyway, yeah, on the right side, so they had me lay down. I was on a bed. They gave me a pillow to place my, you know, to lay over on my chest, and I just kind of gripped the pillow. And then she put some kind of cream or like antibacterial on it. And then I believe, and you have to bear with me because my face was looking towards the corner. So I didn't see everything that was going on behind me. So it's what I was hearing and feeling. But I know she put some kind of solvent on my lower back, I think to disinfect that area. And then she started with, I believe it's called lycopene. And that is the numbing agent that is used to make sure that you're supposed to not feel what they're doing, because if you felt that, you'd probably pass out. So she started with that. Unfortunately, that took her several tries. It took a lot longer than normal, is what I was told. So this is typically like a 10 to 20 minute little procedure. I think it took them way over 30 minutes for this. So it was intense. Yeah, so she was poking around in there, and she was hitting certain nerves, and that would give me a jolt of pain. So that would kind of make me jolt up, and then she would try other areas. So that went on for a good, I don't know, probably 10 minutes. And then they have a tool, which I'll insert a video somewhere, that shows the tools that they actually use to extract the bone marrow and the bone fragment. And I'm really glad I didn't see that beforehand, but I will insert that probably right here in this video.
So it's like this. And then they go in and they screw down. And then they take this out. And then they take the things and they suck that out. And then they put this back in. They leave this out. And they just screw down in there. And then they put all that on. And then they push the bone out of that.
Oh my God.
So they use that tool to, after they've injected you with the lycopene to numb you, they insert this tool, and that basically they drill that down manually, and then they are able to pull out all of your bone marrow and the bone fragment. And it's supposed to happen pretty fast. What ended up happening with me is I think they struggled a little bit. I was told that my bones are very good, very strong, and they were kind of joking with me like, Tara, do you work out a lot? Because apparently I have a lot of muscle. So I think that was, giving them a hard time with giving the lycopene injection and then, extracting the bone marrow. So they actually had to call in my oncologist to manually do it for me. And that was pretty fast, but boy, did I feel that. It's a very weird sensation. It felt, I think I even said out loud, like, I think my bone's cracking. I think my bone's popping, my bone's cracking. Because it's just not a natural feeling at all. And I've never broken a bone, so I don't know what that would feel like, but it was strange. And it was uncomfortable. So I'm not going to sugarcoat it. I'm not going to pretend that this was a pleasant operation. But, I'm sitting here. It's now been about, I guess, 2 or 3 hours after the operation or the procedure, and I'm okay. I have, they gave me a little bandage behind here. I'm supposed to ice this. I'm just going to be laying around for a while, and it will hopefully, heal pretty fast. So that's how it worked. It was pretty crazy, but I did want to document this because, there's so much out there, and hopefully if people are curious, or maybe if they know somebody that will be undergoing this procedure soon, hopefully I can give them a little more insight. I'm not trying to do this to scare people, but I did want to, document my feelings about this procedure and, just the real reaction that I did have, my opinion of it. But I will say I got through it, and it's necessary. So I got through it, and I'm one step closer to getting into treatment, getting my chemo started to get rid of this tumor I have. So yeah, did it hurt? Was it an uncomfortable, 30 minutes of my life to help save my life? This is worth it. And I'm sitting here hours after, and I'm okay. So you just got to be strong. You got to get through it. I would definitely recommend not Googling this procedure beforehand, because you're just going to freak yourself out. I would just go in. I would ask a lot of questions beforehand with your doctor. And definitely, if you are someone like me that gets anxiety before these procedures, or you just don't want to feel it, like I would hope most people don't want to feel this, express that to your nurses, and they will help you. That's why they're there. They don't want you to be in pain. So ask for something to give you a little bit of a calming effect, maybe some sedation, and you'll be good to go. You will get through it, and you will get that much needed biopsy results so you can start your treatment. So that's where I'm at. I feel strong. I feel like I can do anything after this. And I'm one step closer. So that's it for now. I will hopefully have an update later. I still have a PET scan, and I have to, they're going to be putting my port in my chest this week. So lots more to look forward to here. So far, I got through the day, and I'm just going to rest now and hopefully talk soon. Thanks for watching. Bye.